And what is that one belief you had as a doctor when you started out, but now you don't have it at all?
I used to think that it's my job to fix people or my job to create healing in people. It's totally false. We cannot heal people. We cannot change people or fix people. If anything, now my prayer is, can I be a guide?
Mm.
If someone is looking for a path, they want clarity, they want knowledge, they want support. Can I be a GPS Google map that's navigating? They're driving their life. They are masters of their life. I'm nobody to assume that my degree on the wall means that they'll do exactly as I say when they leave this room and go into their life.
They also think the belief has shifted because now you don't identify your sense of self worth based on how your patients are, but you truly know who you are. You're giving them that value, and it's up to them to take it or not take it.
I think so. Yeah, I may not have connected the dots, but definitely knowing and feeling right in your own heart that I know I'm going to do best for this person. And it's a 50-50, or it's a 100%, 100%. I'll put in my 100%.
Mm.
They'll put in their 100%. But there is a space in between us, which is the relationship, the doctor patient relationship. I can't go on to their side of the universe and be for them.
Mm.
I can be around, and a lot of times this comes up in our own relatives and our family members, is you have all these degrees and you want to change them, but unless and until your loved ones have internally decided
Mm.
that this is what they want to do, it's very obvious in your closest relationships
Yeah.
that you have to give them that space for
Yeah.
them to take ownership of their journey forward.
Yeah.
You
That's
know?
why they say people don't change for anybody, they only change for themselves.
Exactly. And the sooner a doctor realizes that, especially in the way I'm looking at healthcare behavior change, the sooner we realize that, hey, our job is to be as high quality a support system and knowledge base for them. So, like this calorie thing, our job is to remove scientific myths,
Mm.
bust the information, empower them with the right scientific knowledge in this noisy world where so many influencers with so many opinions, nobody knows what to listen. So, we should give them that trusted space to get information, help them make their decisions.
Mm.
So, a big part of my work is coaching,
Mm.
motivational interviewing, for example,
Mm.
right? So, this was a big revelation for me. Is the whole change in the dynamic. It's a meeting of two equals.
Mm.
Motivational interviewing means we are equal,
Mm.
and you are the expert of your life.
Mm.
I might be an expert with my degree in hormones or diabetes, but you are the expert in you.
Mm.
So, for this to work in your life, which is all about behavior change, you are the expert in your behaviors.
Mm.
So, let's say somebody says, I have a sweet tooth, and they're seeing me for diabetes.
Mm.
So, the sarcastic response in my head could be, what do you want me to do about that? Right?
Yes.
Like, are you crazy?
Yeah.
I mean, you have this, and so be judgmental.
Yes.
Okay. So, that's definitely not going to help.
Yeah.
So, not that response. Okay, so how to be in a motivational interviewing space is, can you show the person that they're stuck?
Mm.
They've trusted you with this information,
Mm.
right? They're struggling. So, what does it mean to be stuck? Stuck means I have one need on this side, I have one need on this side, and both the needs are pulling, and I'm caught in the middle. What are the two needs? On one hand, I can see that you enjoy sugar. Perhaps it gives you some pleasure. Perhaps it gives you reward at the end of the day. Perhaps it's a distraction from something else and you need it. And on the other hand, you're talking about this right now because you're also thinking about how it affects your diabetes and you want your diabetes to be better.
Mm.
And you have both of these needs, valid needs on both sides,
Mm.
a need for pleasure, a need for health. And then when you say it like this to that person, for the first time, they don't feel judged or shamed.
Yes.
They feel heard and
Heard.
seen.
Yes.
That changes the whole game.
Mm.
So, discovering this tool of motivational interviewing has been, again, career changing for me, life changing as a parent, life changing as a spouse. Now, I cringe when I hear people not using it in life because this comes in daily conversations.
Right. Why do you think a lot of doctors are not doing this?
Not trained.
Okay.
That's one big reason.
Okay.
It's a skill that most people don't have.
Mm.
Luckily, the psychiatry space in India is definitely picking it up. It is a training that they get.
Mm.
But in the diabetes or in the traditional, emergency of like allopathic fracture or pneumonia or, ICU, it's very difficult to talk about behavior there because they're dealing with a crisis.
Okay.
Okay. So, and maybe it hasn't yet been brought in as a training concept.